Dr. Mike Patten from Blue Waters Health Center. I'm here today, just kind of do a podcast of sorts, but just taking different topics and just kind of expounding, explaining on those that I wouldn't normally talk this long on a short. So I'm doing this in a more expanded format. And so the first topic we're going to take today is why my pain kind of keeps coming back even after treatment. Because what happens is I get a lot of people that come in, and I'm sure a lot of other docs do, because I talk to them and I hear from them. And what happens is they'll apply that first treatment, or maybe if it's the second or third, and a person will feel fantastic after the treatment. But what will happen is over the next couple of days between the treatments, they'll start to feel a lot of the things coming back. And the question is always, why do those things keep returning? And it's a fantastic question. So to really get underneath that, we're going to unpack it in a couple different ways, and then we're going to kind of view it from different angles so we can get a total picture of why pain keeps returning even after we've had a treatment. So first off, we have to understand where problems come from. So any kind of disease or any kind of symptom or any condition in the body that's not health has three kind of points of view, three perspectives to it. So the first one is a physical cause. The physical cause is that it's a concussion of forces, is what it is. So we are fine, and then we did something, and now we don't feel very good. That's a physical cause. We can point to a moment in time where the problem existed, it started, and we can feel an effect from that. An example of that would be is if you're playing basketball. Now I enjoy basketball, that's why I'm using it as an example. And say we've been going up, you go up for a layup, you lay that ball in, and you come down on someone's foot and you turn that ankle. Before that layup, you're fine. After that layup, you weren't. You notice a moment in time that was you rolled your ankle. That is a physical cause. You have physical injury to that ankle tissue, which requires treatment. To give you another example, it'd be like an individual that was in a car, they're driving down the road, someone runs into them. They're fine before they got ran into by another car. After they got ran into by that car, they're no longer fine. That becomes a concussion of forces. That individual now has physical impacts to their body. They have physical injuries that need treatment. Now we go on to number two. Number two is a chemical or nutritional cause. A chemical and nutritional cause usually involves some sort of change as well. Now it can be a degradation of tissue over time as well. So we look at what those chemical causes can be. Now in a nutritional realm, that can be having a very poor diet, something that's very high in carbohydrates and sugars and processed foods. Those type of things will degrade and degenerate the body over time, especially if it's something that's been long lasting. Now, the next thing we get into is we get into the drugs. Now, those can be legal or illegal drugs, as those drugs have a change on the body and the body's chemistry and even the mind. They can impact how the body functions. Now, we also can't rule out environmental toxins. Those are the kind of things that maybe we clean our house with. They can be things that maybe they seep into our environment through means that maybe not be under our control. And these environmental toxins can absolutely play a role in our body and in our health. And so we need to be aware of them and where they come from. But usually what we're looking for is a change. So if your diet's been consistent and we haven't added any new medications, we haven't changed anything in that realm, nothing's different in our house, we're looking for a change. So if you recently changed your diet and now you have symptoms, we can understand that that diet may be playing a role in that new change, especially if we notice that there isn't really a physical cause. Now, what can also happen is maybe we started a new supplement, maybe we started a new medication, we're on a different regime of our medications or supplements. Those can be a change in our body. And when they change inside of our body, we also have to have a change in our expression through our body, and that can develop into what we call symptoms. It can also develop into health when we take those things. Now, we can also look at maybe there was a new building constructed that's blowing a lot of smoke at your house. That would be an example of an environmental toxin. And that's something that your body has to deal with. And when your body begins to deal with it, you may develop symptoms, maybe coughing, maybe redness in the eyes, things like that, that are responding to this outside external stimulus. Now, the third area, the third category that we're looking at is that emotional realm. Now, that emotional realm tends to be the lion's share of what we struggle with. And that emotional realm, that can be anything from a thought, that can be anything from an emotion, that can be problems in our marriage, that can be problems with our children or between siblings, that can be problems with our parents. Struggles with your job, that can be problems with money. Maybe you don't like your job, that can be a stress as well, or the job's been a little slow because we haven't really understand that law of rhythm. And those are all different types of stress that can be in the emotional realm. We classify them as emotion, but it can really be a thought or a belief that's incorrect. And what I mean by incorrect is that it's causing pain. If it's causing pain, then it's incorrect. Now, you may not view it as incorrect, but the fact that it's causing pain is telling you that something is out of balance or out of alignment with the laws that run and govern this world. And when we don't understand or know those laws, it becomes to have an impact and an effect on our body in a physical way. And when they have a physical effect on our body, that produces illness and sickness and disease and other things that we're trying to avoid. And so those are the three areas that disease, illness, sickness, things like that come into our world that give us a sense of unease, ill health, whatever you want to describe it. Those are the three areas. Now, the question originally was, why do I keep having these injuries, these illnesses? Why do I keep having this pain specifically after I have a treatment? So I have, maybe you had a car accident, take for example. Let's take car accidents because in Florida, here in Florida, especially Sarasota here, that's something that's very prevalent. So we get in a car accident and there's pain, say in the neck, and you go get physical treatment for it. And then after that treatment, you have pain. You still have pain that exists in the neck. Well, on a physical level, we can look at it as the tissues of the neck actually had physical impact, and there is a time lapse that requires that tissue to heal up. But we should see it in a nice upward trajectory. Now, it may not be consistent and always moving in an upward trajectory, meaning some days you may feel a little better than others, just based on a lot of different things, concepts you have in your mind, the food that you eat, it can be just the physical nature of the tear down and repair of that physical tissue. Now, from a chemical standpoint, a nutritional standpoint, if you go get treatment and you feel better after the treatment, and then you go drink your 5 Diet Cokes, because I had a patient that drank 6 Diet Cokes every day, and that was the cause of her stomach problems. Every day she drank 6 Diet Cokes. Their family spent $10,000 trying to figure out what was going on with the stomach problem that was causing her to lose weight. And she was drinking 6 Diet Cokes every day. So I could treat her all day, but until she removes the stimulus, which would be those 6 Diet Cokes, she is going to continue to have stomach problems. These stomach problems will persist because there's a chemical nature. So even though you have treatment, even though that treatment's there, it's the right treatment at the right time for the right reason, because we're continually putting a stimulus in the body that's causing an irritation. That is what is going to continue to have pain even after a treatment. Now, the last one would be in this emotional or conceptual plane. Now, if we go get treatment and we feel better, and say we feel better for about a 24-hour window, say we had stomach problems, we get adjusted, you feel better, and we're better for about a 24-hour window, and now it comes back again. Now we start looking at where in your kind of mental belief world is this getting caught up? Are we getting caught up in a situation where we don't like our job? And so we go get treatment after work, and then we feel better. Then we go back to the same job that we don't like or don't enjoy or aren't really equipped for. And then as the day goes on, we just slowly break down that tissue because we have that same thought coming up of, I don't like being here, I hate being here, or maybe I don't like the people I'm working with. And as long as we're in that same environment, the pain continues to kind of just slowly come back over time until we go get treatment again. And then the cycle continues. And so the pain keeps coming back over and over, even though we've had treatment. And so you can see that a mental thought can be the reproduction of these symptoms and of this ill health over and over again. So those are kind of the three areas where we run into situations where we can have pain even after we've had treatment. And that can exist for any part of the body. So say we have a lower back injury. We come in, our lower back hurts, you get adjusted. It feels better after we get adjusted. Or maybe you do a decompression. It feels better after the decompression, or you do acupuncture, or you do physical therapy, or you get an injection. Whatever the treatment may be, it really doesn't matter, because if there's a mental thought that's involved in the cause, that issue is going to come straight back again. And it's just a matter of time. How long does it take for it to come back after that treatment's been rendered? Really depends on how much we've held on to that mental concept. Now, on a physical plane, what we should see is a nice continual improvement. So if it's purely a physical thing, if the pain comes back, then we're doing something to irritate the tissue. If we injured that tissue in a gym and we were working out, or on the job doing, maybe we had lifted too much, and we go back the next day and lift, and the tissue hasn't healed up enough to just really respond to that tissue and be able to do that, then what's going to happen is we're going to re-aggravate that same injury because it's not strong enough to do that. Likewise, if we're going to continue the poor eating habits even after treatment, the same things are going to come back. So if we have, say, headaches, and it's really driven by an excess consumption of sugar. Now, if we get treatment and we feel better, and then we go right back to the same thing that caused it in the first place, of course, those things are going to come back again. So when we have pain that returns after a treatment, it's not necessarily a failure of the treatment. We have to look at what's inside our world. Is there something that we're doing? Is there a habit that we're doing? Is there something that we're consistent on over and over again? That's we're just really trying to figure out, okay, what did we do that changed? Something changed. And if something didn't change, what's the mental concept that's in our way? Because those are the things that are going to reproduce pain. They're going to bring them back, even though we've had treatment. And so it's not always a failure of the treatment. It might be that there's something we need to address in our physical world and change that to allow the physical things to heal. It might be something that we need to address in our nutritional or chemical world to get away from something that's causing a trigger in it. And if it's something in our mental conceptual world, we have to find a way to deal with that. Maybe it's talking with someone. Maybe it's journaling or writing. Maybe it's sitting down and using the triangle of knowledge. And if you don't know what that is, you're going to have to pay attention to a future video in order to get that. But really start with the law of polarity. That's a great place to start. We'll realize that there's always two aspects to things. And if we have a mental concept that we're struggling with, realize that there is another side to that and look for the good that's in that situation. And when you find that good, that's going to help to neutralize that mental concept. That's going to help that healing to stick better and just kind of move forward at a more rapid pace. Thanks so much for watching. Thanks so much for listening. This is Dr. Mike Patten with Blue Waters Health Center. And stay tuned for more of these kind of podcasts as we drip out and we just kind of delve through more topics related to health and our body and our healing.